The Ministry of Health has released a final report into the death of 29-year-old engineer Charles Amissah, revealing what investigators describe as medical neglect and systematic failures within Ghana's emergency healthcare system. The report, presented on May 6, 2026, by a committee chaired by Professor Ajiman Bedu Akosa, concluded that the young engineer died not directly from injuries sustained in an accident, but from delays and denial of emergency medical treatment after being turned away from several hospitals due to the country's persistent no-bed syndrome. According to the committee's findings, Charles Amissah was transported to several health facilities including Police Hospital, Greater Accra Regional Hospital, and Kolebu Teaching Hospital, but failed to receive timely emergency care despite remaining alive throughout the transfer processes. The reports describe his passing as a slow death from medical neglect, stressing that prompt intervention could have saved his life. Doctors named include Dr. Anne-Marie Kudowo, who was cited for allegedly failing to attend to the patient at the police hospital and for providing untruthful information to investigators. Also cited were Dr. Nina Naomi Adotevi for failure to provide care at the Greater Accra Regional Hospital, as well as Dr. Ida Duran and Dr. Genevieve Aja for negligence at Kolebu Teaching Hospital. The committee also named 3 nurses for sanctions. They are Miss Akosia B. Texan, Miss Joy Daisy Nelson, and Miss Salamatu Al-Hassan Adu. Investigators further identified major systematic failures, including poor communication during emergency transfers, inadequate documentation for patient vital signs, and insufficient emergency response skills among some healthcare personnel. As part of immediate actions taken following the report, Kolebu Teaching Hospital has interjected 2 doctors and 2 nurses implicated in the case. The committee has recommended urgent reforms in Ghana's emergency healthcare system, including a nationwide review of emergency response protocols and the implementation of a digitalized bed management system aimed at ending the long-standing no-bed syndrome.
Hospital failed to triage the patient and initiate stabilizing interventions. Ambulance moved with the patient out of the hospital after 17 minutes. And you can refer to that snapshot, 118 minutes referral anomaly. In Kolebu Teaching Hospital, ambulance arrived at the hospital with the patient alive. Hospital failed to triage the patient and initiate stabilizing interventions. Ambulance crew was redirected to from Kolebu Teaching Hospital to UGMC, but they refused. Patient died in the ambulance in about 70 minutes while in hospital. Key findings in respect of the professionals. Dr. Anne-Marie Kudowo failed to exercise ethical and professional judgment prudently by not attending to Charles Amissah in a life-threatening condition at Police Hospital, leading to his death later from severe loss of blood. And she was untruthful to the committee. Dr. Nina Naomi Ezram Adotevi failed to exercise ethical and professional judgment prudently by not attending to Charles Amissah in a life-threatening condition at Greater Accra Regional Hospital, leading to his death later from severe loss of blood. Ida Durant failed to exercise ethical and professional judgment prudently by not attending to Charles Amissah in a life-threatening condition at Kolebu Teaching Hospital, leading to his death later from severe loss of blood. Dr. Genevieve Aja failed to exercise ethical and professional judgment prudently by not attending to Charles Amissah in a life-threatening condition at Kolebu Teaching Hospital, leading to his death later from severe loss of blood. Akosia B. Texan failed to exercise ethical and professional judgment prudently by not attending to Charles Amissah in a life-threatening condition at Greater Accra Regional Hospital, leading to his death later from severe loss of blood. Ms. Joy Daisy Nelson failed to exercise ethical and professional judgment prudently by not attending to Charles Amissah in a life-threatening condition at Kolebu Teaching Hospital, leading to his death later from severe loss of blood. Ms. Salamatu Al-Hassan Edu failed to exercise ethical and professional judgment prudently by not attending to Charles Amissah in a life-threatening condition at Kolebu Teaching Hospital, leading to his death later from severe loss of blood. Conclusions. The medical staff on duty at the police hospital, Greater Accra Regional Hospital, and Kolebu Teaching Hospital failed to attend to Charles Amissah when he was in a life-threatening condition, and this led to his avoidable death.
Receiving the reports, the Minister of Health assured that the recommendations would be implemented fully to help prevent similar incidents in the future. The death of Charles Amissah has reignited public debate over accountability and the state of emergency healthcare delivery in Ghana, with many calling for swift reforms to prevent similar tragedies in the future.
And just to assure you, the details of the report, especially the recommendations, will be implemented to the letter. I want to accordingly direct my chief director, the chief director of the Ministry of Health, to write to the following people, the following health professionals, and their hospitals, and their regulators, that disciplinary actions be taken against them. 1, Dr. Anne-Marie Kudowo should be referred to the police hospital and the Medical and Dental Council with immediate effect. Dr. Nina Naomi Iram, the Greater Accra Regional Hospital, and the Medical and Dental Council. Dr. Ida Drant be referred to Kolebu Teaching Hospital and the Medical and Dental Council. I understand some of these facilities have already started disciplinary actions against some of these people, and I'll urge them to expedite action on them, and their respective regulators must also do same. Dr. Genevieve Aja must also be referred to Kolebu Teaching Hospital and Medical and Dental Council. Ms. Akosua B. Texan must be referred to the Greater Accra Regional Hospital and then NMC. Ms. Joy Daisy Nelson, Kolebu Teaching Hospital and NMC. Ms. Salamatu Al-Hassan Bedu must also be referred to Kolebu Teaching Hospital and NMC. Before this incident, some measures had already been taken with respect to our emergency response in this country. We had already started the electronic bed management. And so at that point, we're doing the barcoding and the inventory taking of all beds, beginning or piloting with the regional hospitals and the teaching hospitals. So today, ladies and gentlemen in the press, will have the opportunity to visit that particular site at Greater Accra Regional Hospital to see the progress made so far. That is an action the professor was talking about. The second one was another recommendation that the Critical Care and Emergency Center or Emergency Hospital at the Ghana Armed Forces must be also made available to the public.